I'm Abra Douglas. I'm 34 years old. I had COVID in September of 2020. I had a very mild case. I didn't have any respiratory issues. I thought I had a sinus infection for about a week until I lost my taste and smell. So that prompted me to then get tested. I lost my taste and smell for about a month, and then it came back completely normal. I didn't have any issues. Everything tasted the same, smelled the same. And then about a month after that, in December of 2020, I started experiencing these phantom cigarette smoke smells that I knew weren't there. No one in our home smokes. So it was just very odd, and it was very strong. So that was kind of like my first, inkling is that something was off. And then that lasted about a month, and then it then translated into altered taste and smell. So anything that I would eat, anything that I would smell, the best way to describe it would just be rotten eggs. It was just like burned sulfur. It was vomit inducing at times. I mean, it was just, I couldn't eat 95% of things. No meat, no vegetables. I was living off of plain boiled pasta, and I think I could do strawberries was the only other thing I could eat. So it was very life-changing.
I could see how that would be distressful and uncomfortable, and it's a quality of life issue.
Yeah.
So what are some things that you tried to get over that?
Well, it took me a while to figure out what this possibly is. So of course I'm scouring the internet, and I end up finding all of these support groups of people. I didn't personally know anyone who was experiencing this post-COVID. And, I'm a nurse, so everyone I work with has had COVID. I've taken care of lots of patients who've had COVID, and I've never personally encountered someone who has this very strange reaction post-COVID. So, it kind of sent me on a mission to try to find out what this is. A lot of people were going to see ENTs because it makes sense, with your altered taste and smell, and they just weren't getting any resolve with that. No one really knew what it was or what it was caused from, and a lot of people were giving other suggestions of things to try. So I have tried scent training, where you try to retrain your senses with essential oils. I have tried hypnosis. I have tried acupuncture. I've tried forcing myself to eat things that taste terrible, thinking that maybe it'll kind of cause a reconnect and things will start working the way that they're supposed to, and none of those were successful. So
I can understand, yeah. I mean, and that's ultimately what led you into my office.
yes. Okay.
So what are some things? So what are some things that you that brought you to my office? What really brought you in?
So, in trying to find answers and things that may help, we stumbled across encounters of people who have undergone a ganglion nerve block, and so that kind of sent me on a hunt to try to find someone who would be willing to try to use that to treat this specific problem that is not typical. So I wasn't thinking or hoping, of course I was hoping that it would be 100% cure, but also I'm being realistic and thinking that it might not do anything, it might improve a little bit, but I just was hoping to at least try to see if I could get any sort of improvement. So that led me to Dr. Shetty's office. You were willing to try, and the first block was on the right side, and that was definitely life-changing improvement for me. We joke around, it's almost like magic. I did have to plug the left nostril after that first block, since the left side hadn't been done yet. But in nearly 2 years, I was able to eat meat that I hadn't been able to eat. I was able to eat vegetables, and they tasted normal. And it sounds so silly because it's just food, but when it disrupts your life to the point where it's nauseating to be around it, and you can't go out to dinner with your family, and you can't have holiday dinners with your family, it really does change your life and the way that you cook for your family and you interact with your family. So that was definitely a life-changing improvement just after having had the first side done. And I didn't mind at all that I had to plug the left side. It was still, I didn't care if I looked ridiculous when we went out to eat. It was still something that I just hadn't experienced in almost 2 years, and it was truly amazing. So.
Great. And then, Ms. Douglas, earlier this week, we brought you back and we did the other side, the left side. So how do you feel now?
Since I've had the left side done, I've continued to see more improvement. I would say I'm 90 to 95% normal in what I'm able to eat and taste. There are a couple of things that are still triggering. I would say eggs and chicken are the two that are still, if I plug my left nostril, they do taste normal, they taste fine, but I can't really enjoy it completely if I don't have that left side plugged still. But beyond that, I mean, I'm able to eat and drink pretty much anything, which, like I said, in the last 2 years, that has not at all been my life. So
Great. So you feel like you've gained a good portion of quality of life. I mean, eating and drinking is a big part of
yes.
livelihood. You feel like you've gained a lot of that.
Yes. I mean, compared to what I was, when did we first do this? 2 or 3 weeks ago?
Yeah.
I mean, it's completely different, a different life, truly a different life, and what I'm able to do with my family and,
Great.
enjoy dinner together.
Yes, of course.
Yeah.
Thank you. So, Ms. Douglas, in case patients may be wondering, specifically, what about the stellate ganglion procedure? Maybe they have some questions, some concerns, maybe they don't like needles. How was your experience getting that procedure done now twice?
I would say it was great. It's very quick. It's not painful at all. I mean, it's a little uncomfortable in the sense that, it kind of stings when you inject the lidocaine or whatever numbing agent you're using. And then, a little uncomfortable with the advancement of the catheter, I assume is what that sensation is, but it's not at all painful. It's just a little uncomfortable, but it is so quick. I mean, I would do it 100 times over to get this result. It's not anything I would be afraid of doing again. I mean, it was a very quick fix for the result that I have, so.
Awesome. I'm so happy for you. And if there's any advice, I guess you would give to patients. I understand you were on forums and you had talked, so there's a little discussion group of patients maybe across the country who had similar symptoms to you.
Yes.
What advice would you give to them now?
I would definitely encourage anyone who's struggling with this post-COVID to try it. I mean, of course, there's no guarantee, like there isn't with anything, but it is 100% worth trying because it truly is. I mean, it's helped. Even if it doesn't help someone 100% and it only improves 50%, that is still a life-changing increase from what we're at now or what I was prior to this. So anyone who is struggling with this, I would 100% encourage them to at least find a physician who's willing to try this course of treatment because I'm truly blown away at the result.
Awesome. Thank you very much.